Lung cancer can remain dormant for more than 2 decades. Lung cancer is the leading cause of cancer death. Over 40,000 people are diagnosed with the disease each year. But less than 10% of the patients survive for 5 years or more following diagnosis. Late presentation and diagnosis are key reasons for the very poor survival rates from this disease. Lung cancer can remain dormant for more than 20 years before suddenly becoming aggressive. The study, published on October 9 in the journal Science, reveals that the initial genetic errors that caused the cancer can go undetected for many years. So, the disease can remain dormant and undetected for a long period of time. This dormancy ends when new, additional genetic mistakes occur and trigger rapid cancer growth and it becomes aggressively active. Professor Charles Swanton is the study author. Different genetic errors appear in separate parts of the tumor and the cancer expands. These defaults evolve down different paths, leading to a tumor consisting of multiple genetically unique parts. The large variety of genetic errors found within lung cancers explains why targeted treatments have had limited success against the disease. A lung cancer biopsy may identify a specific genetic fault for treatment to target. Attacking that particular genetic mistake will only be effective against those parts of the tumor with that fault, leaving other areas to thrive and take over. So, the survival from lung cancer remains devastatingly low, with many new targeted treatments making a limited impact on the disease. By understanding how it develops, researchers opened up the disease's evolutionary rule book in the hope to predict its next steps in management. This exciting new research highlights that discovery of cancer lying inactive for several years will lead to improvements in the early detection of the disease, when it's still following just one evolutionary path. If diagnosed at a very early stage in their evolution, we might be able to tackle the disease earlier and dramatically improve the survival rates. The study also highlighted the role of smoking in many of the early genetic faults leading to the development of lung cancer. Other risk factors include passive smoking, use of other tobacco products, toxic substances and a family history of lung cancer. Though early genetic faults are caused by smoking, as the disease evolves these mistakes became less important. A new process controlled by a protein called ApoB is responsible for creating further multiple new mutations. This fascinating research highlights the need to find better ways to detect lung cancer earlier when it's still following just one evolutionary path. If we can nip the disease in the bud and treat it before it has started traveling down different evolutionary routes, we could make a real difference in helping more people survive the disease. Hoping for that day. Thank you all.